As an emergency physician, mostly I'm flying blind. You come into the emergency department and I have to give you the right treatment, the right medications, the right safe care without necessarily knowing much about you. It's critical that you share information with your emergency physician, even sensitive information like mental health, HIV, or substance abuse history, because otherwise I'm likely to give you a medication that could cause harm or even death. It's very common that I see children coming in with their elderly parents, and I ask, well, what medications are your mother and father taking? And what I get is a bag with 14 pill bottles, and they say, yes, they're taking the red one and the blue one.
Fortunately, this situation is changing as more and more healthcare providers turn to electronic health records, which can be accessed quickly and easily to get accurate information. The benefits of electronic records extend far beyond the emergency room.
I can access everything from vital signs, progress notes, medication records. I can look at a record of previous surgeries and anesthetics. I can look at laboratory tests, and in fact I can graph them so I can see them over time. And I can look at films. It's organized in a way that I can access them quickly because they're under note titles and I can search for them more efficiently.
The average patient above the age of 70 has 10 doctors that they see. And that means they see a primary caregiver and a specialist and an ER doctor and a hospitalist. Oh, and they have a lab done by Quest. Oh, and they have a Shields MRI center. Their record is fractured.
Dr. Redfern, nice to meet you.
A lot of people change doctors all the time. You change health insurance all the time. There's no one place you can go to get your medical record.
An electronic medical record has the ability to bridge these gaps, improving both the quality and efficiency of healthcare.
When I go to a doctor for the third time, for the fourth time, for the fifth time, I don't want to be asked to fill out the same piece of information over and over and over again. I mean, there's always a chance that I'm going to get it wrong the fourth or fifth time.
And the pneumonia shot, do you know how long ago that was?
Maybe 3 years.
Okay. We'll get that.
The benefits of electronic health records are easy to appreciate. But what are the implications for the privacy of your sensitive information?
The easy access to the health information has a flip side too. The good side is you have ready access to it, and the bad side is other people might have ready access to it that you don't really want to see your record.
You might not want your dermatologist to know about your abortion. You might not want your primary care physician to know about your psychiatric issues.
And when personal health information is used for so-called secondary purposes, life insurance, the courts, media, law enforcement, sales, and research, a patient's need for control is even more important.
All patients are concerned about their health information, and it varies from person to person what they consider sensitive and private. It's inevitable that we will proceed with the development of modern computerized healthcare and the electronic medical records that go with it. The concerns that we have about the rights of the individual to privacy and to control their medical information and what's in there and who it goes to, that is of vital importance.
There's so many players in the healthcare market in the United States. It's just very complicated. And everybody who is paying for your health care or who is giving you health care treatment, they have a right to see your record. And they do.
Many laws exist to protect the privacy of your medical records. But understanding all the ins and outs of these laws is a daunting task. A good place to begin is the Federal Privacy Rule of the Health Insurance Portability and Accountability Act, better known as HIPAA.
When you go into a doctor's office or into a hospital or any other healthcare situation, the healthcare provider is required to provide a notice of privacy practices. So they're required to inform patients how the health information about that patient may be used or disclosed. The healthcare provider can use it for treatment purposes, so they can use it to treat you, to talk to a provider that they want to refer you to talk to another colleague, to consult about your case and that sort of thing. They can also use information in order to get paid for the service they provide, so they can submit information to your insurance company. And then the third category is healthcare operations, and that's some general office activities that a healthcare provider or a doctor would need to engage in, like sending out an appointment reminder or scheduling a procedure at a hospital or a clinic for you. It would also include things like disease management programs in order to help manage a patient with a chronic condition. The HIPAA privacy and security rules really provide a federal floor. The goal was to establish a baseline of protections nationwide. But there are a lot of state laws that provide additional protections.
Massachusetts laws are stricter than the laws of almost every other state when it comes to protecting sensitive health information.
Nearly 200 state laws govern the use of health information in Massachusetts. Some categories which receive extra protection include HIV and AIDS, mental health, genetic testing, substance abuse, and sexual abuse. The transmission of this information generally requires a patient's consent each time it is transferred.
For each category of sensitive information, the rules are slightly different.
For example, Federal Law 42 CFR Part 2 requires federally funded substance abuse clinics to obtain written consent before disclosing patient records. Many of these laws were passed to encourage people to seek testing and treatment without fear of exposure or discrimination.
One point that it's important for people to know is that the detailed personal notes that a therapist or a psychiatrist or any other mental health clinician writes in the record about the content of what you say is considered not shareable as part of the general medical record.
While psychotherapy notes have strict privacy safeguards, information about mental health diagnoses and medications can be shared if the patient gives consent, or if the information originates from a provider who is not a mental health provider.
So if a patient visits a primary care physician and talks with the physician about anti-anxiety medication,